Hey, it's Rodney and Shelly from utrainu.com.
Hey.
And in this video, we're continuing with our series of showing you how to use the massage balls in relation to low back pain. So in this video, we're going to show you the TFL muscle, or what's known as the tensor fasciae lactae muscle, also known as the coffee muscle, because that's what it sounds like. All right, so come on up, Shelly. We're going to first show you kind of where the TFL muscle is. So if you want to just place your hands on your hips on your left side there and show them. So just beneath her hip bone, you know, the hip bone that you kind of rest your pants on, that guy right there, just beneath him is a small little muscle that runs from about, you said not a female?
Yeah.
So it runs about 3 or 4 inches long just in this area right here. It is responsible for flexing the hips, so among other things. Once it gets tight from, say, spend a lot of time sitting, which of course we all do, it can then affect your ability to extend your hips properly, which doesn't allow you to use your glutes appropriately, which of course then can affect the low back. So if we can get that guy loosened up and get you moving better through your hips, it can hopefully help. So the first things first is using the ball. We've shown you how to use a foam roller before with this, which you can also do, and you can get at it pretty good, but sometimes just that extra specific work can help a little bit more because you can get more targeted with the massage ball. So the first thing we're going to have Shelly do is lay on her right side, okay? And she's going to take the ball right here. You can just take it and place it in on that muscle. So it might be a little hard to kind of see right there. So she's not quite on her side, but she's also not quite on her stomach. So it's a little hard to describe at first, but what she's going to do is just kind of play around in this area right here to see if she can find that muscle. She'll know if she finds it because it can kind of be like a sharp, a little bit of a sharp pain when she does find it, and it can cause some referral pain down your leg. So it can actually kind of refer right down the side of your leg because the TFL muscle actually does run right into your giant IT band or IT tract, whatever you want to call it, which attaches down to the lateral aspect of the knee. So it can create kind of referral pain down the whole side of your leg. Right, you see she's just kind of moving back and forth a little bit, see if she can find it. You can do this method. You can also, when you find a sore spot, she could just rest on it and just apply pressure to it the same way massage therapists would apply pressure to a trigger point or not until they feel it's starting to let go. And she wants to make sure not to hold her breath and breathe down through her belly. Right. So one other thing I wanted to mention in this was the fact that Shelly's resting up on her elbow. She can be in that position or she can kind of lay down on her side. Whatever you find more comfortable, whatever works for you. She was up on her elbow to kind of not put quite as much pressure on it. And now she's down on her side, it's going to be a little more weight on it. But I mean, if she wants to take some weight off of it, she can kind of roll off it a little bit and then work her way back down to it like that. So that is how you hit your TFL muscle. Once again, thank you for watching.